My research topic today is my original research about smartphone thermal angiography screening for carotid stenosis, a cadaveric study. I want to give a special thank you to all the contribution to this research project from Omer, Morgan, Chloe, Swathy, Dominic, Dr. Hillard, and then especially to my two PIs, Dr. Huff and Dr. Brooks. Without these people, I could not have done this project. So, a little background about current vascular imaging modalities. We have the duplex ultrasound, the computed tomography angiography, and then also magnetic resonance angiograms. These types of imaging modalities are used to either look at localized or broad areas of vascular anatomy in the human body, while also looking at different pathologies within these arteries, more specifically about arterial stenosis. The duplex ultrasound is the most common modality used. It's considered the gold standard because not only does it provide very sensitive information about localized anatomy, but it also provides information about flow velocity that is very important for diagnostic purposes. The CTA and then the MRA are great for looking at broad areas of anatomy and also stenosis. They require contrast for these images. And I just want to introduce my topic for using thermal imaging as a potential imaging modality. So thermal imaging has been around for quite some time. It was created back in the 19th century and was used in police and military efforts and also construction work. The machines back then were really big, really bulky, and it was really hard to use. But now, as technology has advanced, we've started to create smartphone attachments of these thermal imaging cameras. How these cameras work is that any object that emits heat emits infrared radiation that can be converted into these images. And since the technology has advanced to where they become more user friendly, we are starting to see an introduction in research of thermal imaging in the healthcare field. Uh, this study done in 2022 took people with previously diagnosed knee arthritis and took pictures of their knees and compared them to see if they can actually pick up not only if they have knee arthritis, but the certain degree of knee arthritis by looking at the different temperature ranges. And they were deemed successful. You can see here one of the images here. The with this is on the outside of the body where the majority of the thermal image studies have been doing it. So, but now there's looking to see what can we look on the inside of the body with thermal imaging. One of these studies was looking at coronary stenosis in the pig hearts. The results of this study from 30 different pig hearts, they deemed this study successful, not only looking at normal vessels and with normal patency, but they were also able to see suboccluded and also totally occluded arteries of the heart. They use different mediums in hearts, such as ultrasound jelly, to actually simulate the stenosis. And this was really important because there has not been a study to actually look at if there's been research about looking at pathologic arteries anywhere in the body. So our study was to look at the carotid arteries. A little background about the carotid arteries is that stenosis is due to narrowing of the lumen, typically due to plaque buildup. In the United States, for diagnostic purposes, we have four different categories for stenosis. We have no stenosis, and then we have mild stenosis that's less than 49%. We have moderate stenosis, which is 50 to 69%. And then we also have severe stenosis, which is more than 70%. It's important to note that although mild stenosis is treated, it is treated medically. And when we're evaluating if patients need surgery, we typically look at to see if they have moderate stenosis or severe stenosis, because these are the ones that are usually causing symptomology in patients, such as transient ischemic strokes or attacks, or strokes. With these surgeries called carotid endarterectomies to fix the carotid's pathology, there's been a call to complete for completion studies post-surgery. That's to decrease the risk of complications after these surgeries, such as stroke, heart attacks, etc. The current modalities for this is ultrasound, angiography, and angioscopy. With this in mind, we hope to believe that thermal imaging has a role, and we would like to explore the capability of thermal imaging as tools for detecting stenosis in a cadaveric model based on the current NASIT classification system. So our methodology was first to dissect out all the carotid arteries on the necks. We used 47 common carotids. We dissected proximal and distal to the bifurcation right here. While also during the procedure, we did clamp off several arteries, such as the common carotid, more proximal. We cut off the superior thyroid artery, the first branch coming off the external carotid artery. And it is not shown here, but we also clamped the intracranial portion of the internal carotid artery. And all of these were to build up enough pressure in the vessels to, one, pick up a good image, and two, to simulate how it would be in real life. While injecting warm or cold fluid into these common carotid arteries, we were filming. You can see here the clamps are placed here. And then after we were injecting warm or cool fluid, we dissected out these arteries to ensure that we were not only seeing stenosis, but the degree of stenosis. So we used three main techniques. For this presentation, we only use techniques from technique A. That's because we got the best quality images from this technique, where the normal room temperature was around 68%, which means our donor/cadaver temperature was also 68 degrees Fahrenheit, where we pushed warm fluid through. Technique B is where we use the same normal donor temperature, but it was cool fluid pushed. And then technique C, for translational purposes, we pre-filled the arteries with warm fluid and we pushed room temperature fluid through. And this was to simulate how we would see it in the real world, to see if it would work. So here you can see that we are injecting, using technique A, warm fluid. Here's the outline. You can see the common carotid artery, the bifurcating into the external carotid artery, and then the internal carotid artery. What you're also seeing here is that as the fluid is rushing past, you can see the stenosis and how it's lighting up perfect on the thermal image. You can see that it's neatly delineating the stenosis, and it's resistant to temperature change, because in plaques, we have a lot of calcifications, which are resistant to temperature change. So on the right side are those different NASIT classifications for no stenosis through severe stenosis. For severe stenosis, it may look like that there is nothing really happening, but right here is the external carotid artery with some stenosis, but you really don't see anything being pushed past here. That's because the internal carotid artery was 100% occluded. With all this in mind, we showed that in both moderate to severe stenosis, that we achieved 100% sensitivity to being able to classify them as moderate to severe on thermal imaging after we opened them up grossly and had them examined by a board certified pathologist. If we look at the mild stenosis, although it is a low number of correct, it's important to note that the mild stenosis category is from 1 to 49%, which gives it a broad range. And the mild stenosis that we were picking up on thermal imaging was closer to that borderline of moderate to mild. With this in mind, we really loved our results. We thought this experiment was highly successful. For technique B and C, we had similar results with those two. Technique C, when we tried to translate it as close to an operating room scenario as possible, we were able to achieve a great video and a great image of warming up the artery and then injecting room temperature fluid through to try to simulate how we would push room temperature saline through someone that's already at around 98 degrees Fahrenheit. So our discussion and future direction is that we believe that thermal imaging promises a low risk, non-contrast evaluation of vascular anatomy, termed thermal angiography. We believe that this does have a place potentially in the OR with obvious future studies to look at. When completing a surgery, it's important to have inflow and then also outflow of the area for blood to get through. And we believe that completion angiography using thermal imaging could be a potential role, which is where we're kind of going with our future studies. With this, it's very user-friendly and the cost of these thermal imaging cameras are very low. And we believe that the images that we produce are sufficient enough for quality thermal angiograms. And stepping back away from surgery and looking more at education, we believe that when we're trying to teach students in the anatomy lab, if we provide them a thermal image of either arterial venous structures to see where the fluid goes, it would be great to teach difficult to see structures. Here are my references, and thank you again to all the great people who worked on my project. I really couldn't have done it without y'all. And then a special thank you to the KCU Gift Body Program for the generous donation of donors and materials to complete this project. If there are any questions about my research, I would really love to answer them.
Thank you so much, student Dr. Smith. I'd like to open up the floor for questions. Great talk. Dr. J, go ahead.
Cameron, again, excellent presentation, and thank you very much for your interest in this. The non-invasiveness of this modality is the main thing I think that would to be effective and highly used in that setting. I have some simple questions. Number one, any preference toward a brand of a smartphone? Any indication there which is the best one that would give you the best resolution?
If we're referring to thermal imaging cameras that are more user-friendly and low cost, we recommend looking at the FLIR series. It's spelled FLIR. These are used primarily in construction work to look at pipes and see where everything's flowing. But we've seen other studies, such as the coronary artery with the pig heart, also use this.
Okay, so, and that's a the FLIR series is predominantly just for that purpose. Is that right?
It was made for construction, but we're taking it into the research anatomy lab for
Yeah.
now.
Okay, okay. All right, then that's my main question. And then the general breakdown of mild, moderate, and severe. It's, you feel like that's still something that we're gonna keep as universal? And the only reason why I say that is that it's highly dependent upon the amount of symptomatology that goes along with that degree of stenosis. So, you know, you can have symptoms even though it's 48% or 51%, et cetera. Did you read anything different about the symptomatology and corollary with the sensitivity of percent of stenosis in terms of symptoms?
Yes. So there's actually, with the current classification system, it does, although we do still treat it like mild, moderate to severe with mild, with medical statin therapy. There, back in October of 2023, there was a released guideline from the Society of Vascular Surgeons where, instead of just looking at the degree of stenosis, also looking at imaging to see if different characteristics of these plaques um, is when we need to start treating, such as if there's a hemorrhage within these plaques, but there's no symptomology, there's nothing else. That would be a reason to start this surgery process, even if the patient hasn't had any symptoms, because it's just a matter of time for the plaque to ulcerate and cause either hemorrhage or a stroke.
How about the sensitivity in a series of patients that are asymptomatic? Did you find any useful data or useful information in the asymptomatic group? Or was
Not
it?
yet. Not
really?
yet. I think because the guidelines are new, there's no studies released about using
Okay,
the updated guidelines to see if this is going to help asymptomatic people. In the past, there hasn't been any reason to perform surgery on patients with asymptomatic stenosis, except if their stenosis is more than 80%.
absolutely, yeah. Very good presentation and appreciate your response to those questions.
Student Dr. Smith, I put a link in the chat. I think it's the FLIR website where you can go buy it for your Android or Apple cell phone. In case you're really
Yep.
interested, Dr. J, it's on sale for $400 right now.
Now, I just use mine to tell time.
And yeah, I use it to know what to do in any given day with Outlook. Dr. Wolf, go ahead.
Yeah, thanks. I was curious if you had tried looking at yourself. I mean, like your forearm or something like that. I'd be inclined to say put a blood pressure cuff on and cool down my forearm with an ice pack or something and watch the blood reflow through that, because I mean that the challenge for some of the stuff that you're talking about here is you got to dig down to it. So by the time you've dug down to it, everything was pretty invasive. And I was going, you know, what are the circumstances under which you might be able to use venous flow as an index of something worth knowing?
So since these thermal imaging cameras are detecting surface level temperature, we believe that it could be hard to evaluate the vasculature underneath the skin. But we believe with superficial structures such as the vein or the dorsalis pedis artery in the foot, that there is a certain depth that these cameras do read, and we believe that we can pick the difference in vasculature or the difference in temperature. We do have studies, future studies that we believe we could use this approach, and we would love to evaluate, because we truly believe that there is a role of thermal imaging for vasculature somewhere.
My thought was that if you cool down the skin, though, if it's cold to start with, and you should be able to see it warm.
We so since we're cooling it down in a broad area, with our experience, just looking at the cadavers, it's not going to be able to be read as clearly as we believe. There may be studies such as that knee arthritis one that can pick up the change in temperature, but I don't believe that we can see the changes in vasculature in such a broad area. It would have to be more focused, but it would definitely be interesting to see that.
I'm betting the technology will advance moving forward. Dr.
I
J.
can see that they do use it for superficial veins,
Okay.
for diagnostic blocking.
Dr. J, did you have another comment?
Just had a comment, or asking Cameron if he had any, you saw anything in the literature pertinent to the body habitus of the patient, implying thick, short, heavy set, full necks, a lot of fat to penetrate through. And, the technician, et cetera, could giveth or taketh of disease dependent upon the acoustic shadow that's produced. So my question is there a depth, is there a limit that you saw from the usage of this, let's say, this ultrasonic imaging tool versus CAT scan more sensitive, MR more sensitive, but thermal imaging does it have the limitations just like regular ultrasound?
That is a limitation that we do see, is that it does not penetrate very far past, especially if the body habitus has a lot of tissues in the way.
Right.
I think that will come with technology. Maybe that's the way it's going, is instead of looking at surface level temperatures, looking more in depth. With our study, we dissected all the way into the carotid arteries to cannulate it, because we knew that would be a limitation
Sure.
going into this.
Good answer, nice explanation, and again, I enjoyed your presentation. Thanks.
All right, everyone, we're at the top of the hour. I just now dropped a flyer into the chat advertising student doctors Maple and Smith. And for those of you who are thinking about participating in this endeavor, this little soiree seminar series that we have, you get a flyer and a YouTube recording. Student doctors Maple and Smith, you can expect a YouTube recording in post haste as soon as Zoom processes it and emails it to me. I'll pretty it up in iMovie and ship it to you post haste, okay? Everybody have a great rest of your day. Appreciate you showing up. This is a great session. Looking forward to next week as well. Take care, you guys.
Thank you, everyone.
Thank you.